First, I would like to welcome you all here this morning and to thank you for coming. I would especially like to welcome my colleague, the Honourable Clyde Jackman, Minister of Seniors, Wellness and Social Development, Dr. Sandra Luscombe, past President of the Newfoundland and Labrador Medical Association, and Dr. Michelle Plowman, Board Member with the Newfoundland and Labrador Brain Injury Association. As Minister of Service NL, it gives me great pleasure to make this announcement today. Later today, in the House of Assembly, I will speak to an amendment to the Highway Traffic Act to make bicycle helmet use mandatory for bicyclists of all ages in our province. This amendment will be effective on April 1st, 2015. This will allow time for cyclists to acquire the appropriate equipment and allow Service NL and its partners to develop and implement a public education and awareness strategy. Cyclists who are 16 years and older will be personally responsible for wearing their helmets. Parents will be responsible for their children who are under 16 if they knowingly allow their children to cycle without a helmet. Protecting the safety and well-being of Newfoundlanders and Labradorians is a key priority for this government. Service NL helps to achieve this goal through the development and enforcement of key pieces of legislation. The Highway Traffic Act is one of these pieces of legislation. It regulates drivers and the use of all vehicles on roadways, including bicycles, to establish vital safety standards that protect the public. There have been many studies conducted by reputable medical and safety groups which show the effectiveness of helmet use in preventing or reducing head and brain injuries associated with bicycle-related collisions and falls. It is estimated that the use of a bicycle helmet can decrease the risk of serious head injury by up to 88%. This would mean that 4 out of 5 serious head injuries associated with bicycle collisions could be prevented if every cyclist wore a helmet. The rates of these types of injuries also decrease significantly with the enactment of mandatory legislation for bicycle helmets. The research also supports bicycle helmet legislation for all ages of riders. And I know that Dr. Luscombe and Dr. Plowman will go into further details on the research and medical evidence. In reviewing this considerable amount of evidence, we believe it is appropriate for our government to take action and to increase the protection of all bicycle users in our province. It is our hope that by making bicycle helmet use mandatory for all users, parents, guardians, and all adults will embrace the safety culture we need to create. As adults, we can set the example for our younger cyclists so that they understand how important it is to wear the proper safety gear while cycling. As I mentioned earlier, this legislation will be effective on April 1st, 2015. This will allow sufficient time for cyclists to acquire the necessary equipment and for our government to work with our partners to develop and implement an education and awareness campaign. This amendment to the Highway Traffic Act is critical to the safety and well-being of all residents and visitors who use bicycles on our roadways. They are among the most vulnerable road users in our province. Most importantly, we believe this amendment will save lives and needless injury. Fines for most bicycle-related offenses range from $25 to $180. The fine for not wearing a bicycle helmet will be set within this range. As I am sure that you can appreciate, it has taken a considerable amount of work to make it to this point. We could not have done this without the support and continued dedication of many organizations, some of whom are here with us today. For instance, the Newfoundland and Labrador Brain Injury Association, the Newfoundland and Labrador Medical Association, the Association of Registered Nurses of Newfoundland and Labrador, the Newfoundland and Labrador Public Health Association, Safety Services Newfoundland and Labrador, and many others have done a lot of work and have a direct interest in protecting vulnerable road users in our communities. And I thank them for their advice and support. We also have the full support of the Royal Newfoundland Constabulary and the Royal Canadian Mounted Police. They have indicated they will focus on educating the public and promoting this new legislation as part of their youth initiatives and overall community safety initiatives. A number of municipalities in this province, including the largest urban areas, have already made bicycle helmets mandatory for all ages of riders. Municipalities Newfoundland and Labrador has made a case to extend this protection to all areas of the province. As such, this amendment also responds to their concerns. Between now and the proclamation date, Service NL, along with our injury prevention and safety partners, will work on education and promotional efforts to ensure people are aware of the new law. In closing, I would like to thank you all for attending this morning. I look forward to working with our many community partners to promote this legislation, to make our roadways safer for our cyclists, and more importantly, reduce serious injuries and save lives. Now I call on Minister Jackman, Minister of Seniors, Wellness and Social Development, to say a few words.
Thank you, Mr. Cornect. Welcome, Dr. Luscombe and Dr. Plowman. I'm glad to be part of this announcement today, and I want to thank and recognize some representatives here from Sport Newfoundland and Labrador, Recreation Newfoundland and Labrador, and School Sport Newfoundland and Labrador. They're here to show their support. As you may know, part of the responsibility of the new Department of Seniors, Wellness and Social Development is encouraging active living and regular physical activity among all of our citizens. And bicycle riding is certainly an excellent way to keep fit. But it is equally important to be safe while riding a bike. And that means wearing an approved bicycle helmet to help prevent head injury in the case of an accident. As Minister Cornect noted, the evidence is there. Bicycle helmets reduce the chance of head and brain injuries associated with a fall or collision. And we were chatting before we came down here, and Dr. Luscombe said something I thought that was pretty appropriate. She said, you know, you can transplant a heart or lungs, but you can't transplant a brain. I thought that was quite fitting. This will be a change for some, but not for others. Many adults already wear bicycle helmets, and many parents already insist that their children wear bicycle helmets. And people are very adaptable to change when they know it's about safety and common sense. Just look at some of the examples. Most people don't start their cars today without reaching for their seatbelts. They put their infants and toddlers in car seats. They put smoke detectors in their homes. They don't smoke on airplanes anymore, in movie theaters, in the workplace, or even bars. A great many people no longer permit smoking in their homes. All that is to say that society has evolved. Injury prevention and taking active measures to protect our own well-being and the well-being of our children is becoming more commonplace. As I said, many adults and children already wear bicycle helmets. This legislation takes it a step further and makes bicycle helmets mandatory. Our job now is to promote the legislation and to make sure that everybody in the province has the information and access to equipment that they need to be in compliance and to be in compliance. Finally, I just want to say that there's something that Minister Cornect said that really resonated with me. As adults, we set the example for our children. And so while many parents and guardians already require that their children wear bicycle helmets, it's important that we wear them too. I'm glad to see this legislation being introduced, and I look forward to speaking to it in the House. Thank you very much.
Thank you, Minister Jackman. Now I call upon Dr. Luscombe from the Newfoundland and Labrador Medical Association to say a few words. Dr. Luscombe.
Good morning. On behalf of the physicians of the province, I'd like to thank Minister Cornect for government's commitment to improving the safety and well-being of people of the province by introducing this really important legislation to make bicycle helmets mandatory for people of all ages. This has been an extremely important priority of the Newfoundland and Labrador Medical Association for the past decade, and I have fond memories of coming and meeting with the former minister in Service NL with this government to discuss these issues, and we're so glad today that we're seeing this legislation come forward. We believe that enacting this legislation will significantly reduce the risk of debilitating and life-threatening injuries from bicycle accidents, especially, but not only, in children. Bicycling is the leading cause of sport and recreational injury in children and adolescents in Canada. It accounts for 4% of all injuries seen in emergency departments and 7% of all hospital admissions for unintentional injury. It had been noted that Newfoundland and Labrador has one of the highest rates of bicycle-related injury in the country and the highest rate of bicycle-related hospitalization among children. In 2009, Newfoundland and Labrador had 49.2 bicycle-related hospitalizations per 100,000 people, and that at the time was nearly double the average Canadian rate of 25.7 per 100,000 people. And this was a study that was done, the Child and Youth Unintentional Injury Atlantic Canada 10 Years in Review study that was published in 2009. In fact, the provincial rate of bicycle-related hospitalizations exceeds rates of hospitalizations due to other things such as poisoning, drowning, threats to breathing, playground falls, motor vehicle passenger injuries, pedestrian injuries, ATV and snowmobile injuries, and burns. The human skull is approximately 1 centimeter thick and can be shattered by an impact of only 7 to 10 kilometers per hour. Young cyclists, even quite young, can ride at speeds averaging 11 to 16 kilometers per hour, which increases their risk of head injury especially if they are not wearing a helmet. Most injuries associated with cyclists involve collisions with a motor vehicle, and the most severe of those involve the head and the brain. A properly fitted helmet can decrease the risk of serious head injury, as the minister has also said, by as much as 85%, and decrease the risk of serious brain injury by 88%. We know that the people of Newfoundland and Labrador support mandatory bike helmet legislation to help reduce the risk of head injuries for people of all ages. In 2010, the Newfoundland and Labrador Medical Association commissioned Corporate Research Associates to poll a statistically relevant sample of Newfoundlanders and Labradorians about their opinion of bicycle helmet use. And our survey found that 87% support mandatory legislation that require all cyclists of all ages to wear a helmet. Experiences in other provinces have shown that introducing mandatory bicycle helmet legislation not only increases the use of helmets, but also dramatically reduces the number of injuries by an average of 45%. Research has also shown that introducing mandatory helmet legislation has no impact in the level of recreational or commuting bicycle use. People still keep riding their bike. As the ministers have said, some municipalities in the province have enacted their own bylaws for helmet safety, which has resulted in a patchwork of regulations. However, many communities lack adequate resources to enforce these bylaws. The legislation announced here today will help bolster the municipality efforts and also help the efforts of the RCMP and RNC, who already spend a considerable amount of time visiting schools to educate children about helmet use and road safety. As physicians, we encourage bicycle riding as a healthy physical activity for people of all ages. This new legislation will mean that more cyclists will be protected, and their risk of head injury will be greatly reduced when they do. Thank you.
Thank you, Dr. Luscombe. Now I ask Dr. Michelle Plowman from the Newfoundland and Labrador Brain Injury Association to say a few words.
Thank
Dr.
you.
Plowman.
We've been working since 1982 to help prevent brain injury, but also deal with the effects of the changed life after a brain injury. 2 years ago, we visited around 2,000 students across rural areas of the province, and we're disappointed to see how many children are actually not wearing helmets. And it's more disappointing for us because we see the effects of brain injury. In a moment, life changes forever. Personality change, behavioral change, physical impairments, cognitive and thinking and memory impairments. These things are not easy to recover. The brain is not like other organs that you can replace parts, you can give treatment. The brain is resistant to recovery. Our chance to prevent brain injury through helmet use I think is very potent. I mean, that's what we want to do, is prevent brain injury because of so limited treatment post-brain injury. So I thank the government in making this first step. We would like to see everybody wearing helmets at all times when you're using moving vehicles, motorized and non-motorized, ideally, all adults and children.
Thank you, Dr. Plowman.